A curious-looking magazine landed in my mailbox the other day. It's called Health Time. It's all about a hospital in Richmond Hill called Mackenzie Health. Now, I didn't ask for this magazine, and after flipping through the pages, I won't be reading this periodical given that it's jam-packed with banal PR claptrap, journalism by committee, feel-good pieces about how the hospital's employees are all doing such great jobs. Well, good for them. Yet, even though I didn't want and never asked for this magazine, just like all the other residents of York Region, we're getting the magazine nevertheless, whether we want it or not. And to rub salt into the wound, the magazine is being paid for by, you guessed it, the Ontario taxpayer. Again, whether we want it or not. But the question arises, why? After all, it's not as though Mackenzie Health operates in a competitive marketplace. Mackenzie Health is part of the government-run healthcare monopoly. In fact, it's against the law for the private sector in Canada to establish a private hospital. By the way, Canada is only one of 3 countries in the world that prohibits privately funded healthcare. The other 2 nations are Cuba and North Korea. A good company to be in, eh? Another question springs to mind. How much does it cost to produce this journal? Now, perhaps I need my head examined, but I would think if there's money to burn at any Canadian hospital, those funds should go toward, the purchase of an MRI machine or perhaps hiring more doctors to staff the emergency room. Speaking of which, I've been to the emergency ward at Mackenzie Health, given that this is the closest hospital to my home. It always makes for a soul-destroying experience. Wait times to see a doctor are measured in hours, not minutes. But hey, if I forget to bring along the Lord of the Rings trilogy on my next visit, at least I can pass the time reading Health Time. Now, as a sidebar, the ads contained in Health Time are downright bizarre. For example, one advertisement is for Riza Maridi, the Liberal MPP for the riding Mackenzie Health is located in. But again, why? Another ad is for, get this, Mackenzie Health itself. The whole magazine seems to be drowning in self-congratulatory rhetoric, even though Mackenzie Health only scores a woeful 2.5 stars out of 5 on Google reviews. Even so, this hospital appears to embrace the mantra of Mad Magazine's Alfred E. Newman, what me worry. After all, 4 years ago, the hospital invested in a rebranding effort. You see, Mackenzie Health used to be called York Central Hospital. But I guess someone decided that moniker was too staid, so they went out and they bought new signage and developed a whiz-bang logo. They had their new Coke moment. And faster than you could say ka-ching, an additional $300,000 was charged to Ontario taxpayers. Oh, go ahead, just put it on the tab. Now, I did reach out to the hospital to get its side of the story, but even though Mackenzie Health has a bloated media relations department, nobody wanted to talk, even when I put my questions in writing as I was instructed to. But again, I ask, why is any Canadian hospital in the magazine business? After all, a 2014 report noted that compared with Australia, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, the UK, and the US, Canada has the worst timeliness of care rating and is second worst overall in efficiency. We also have the longest wait times in emergency rooms, and 1 in 2 Canadians in 2014 couldn't see a doctor the same day they felt they needed medical treatment. Yet apparently there's money, your money that is, available to produce a navel-gazing magazine. Feeling sick, folks? Take 2 aspirin and call me in the morning. For the Rebel.media, I'm David the Menzoid Menzies.
Thanks for watching. Click here to never miss a Rebel update. Want even more of the Rebel? Well, click here to become a premium member.